If you've ever had stomach pain, reflux, or an upset gut after taking a supplement or medication, this one is for you. I remembered that once I was given 800 milligrams of ibuprofen twice a day for period cramps, so I decided I could take 800 milligrams of ibuprofen no problem for some muscle and joint pain. Little did I know that with the other medications I was taking and then overdoing vitamin I, ibuprofen, I was setting my stomach up for a diagnosis of stomach ulcers at a really young age. So young, in fact, that some doctors didn't even consider it at all. And a review of my medications was never conducted and to see if that was a contributing factor to the severe gnawing stomach pain I was having. Stick around because I'm going to be discussing both medications and supplements that are known to have upper GI issues. Yes, even those well-intended supplements can cause reflux. So at 17, I received a diagnosis of stomach ulcers, and then I was treated for them. I will forever be in gratitude to the young ER doc who, on a hunch, gave me a GI cocktail to cool the stomach ulcer pain and the burning down. I was able to eat. Now I was empowered with the right diagnosis. I went back to my primary doc and had my first EGD, which is a camera down the throat. They took a biopsy, which are some small pieces of tissue from my stomach and my throat to determine if I had H. pylori infection or something else going on. I was positive for H. pylori, then treated for this infection. Triple therapy is commonly used as the first-line treatment for H. pylori and includes a PPI or proton pump inhibitor like omeprazole and 2 different classes of antibiotics. If this fails, treatment is either a salvage therapy with a much stronger antibiotic, or they move into quadruple therapy. Due to antibiotic resistance developing in H. pylori, quadruple therapy is now becoming more favorable as the first-line therapy. I want you guys to know about these drugs and supplements that may be problematic, not because I want you to stop taking them, but because I want you to have proper informed consent. Informed consent means that you understand both the benefits and the risks of taking a medication, supplement, or getting a procedure. And honestly, it's pretty rare I hear a practitioner that does a medication interaction checker at all. The attitude tends to be, if I didn't prescribe it, it's not my responsibility. My goal is to help reduce harm, period. We need to be advocates for ourselves. Most practitioners are seeing a ton of patients a day. They're maxed out and doing the very best they can with what they know to diagnose and what they know to check for. The patients that tend to see me as a naturopathic doctor want more informed consent and they want to be more involved in their treatment plan. I will also say this, controversial I know, tomatoes and spicy food and chocolate do not cause heartburn. They are telling you something is going on in the body and heartburn is the symptom. Oftentimes it's medication or overeating or not getting enough fiber. There's a few other reasons too. Another aspect of reflux that gets missed is low stomach acid, which causes the lower esophageal sphincter, the little valve between the throat and the stomach, to stay open, and digestive juices then reflux into the throat. Most medications do not cause too much stomach acid, but rather relax this little valve, irritate the throat, and further reduce stomach acid by making the problem of low stomach acid even worse. Why do we even need stomach acid? Who cares, right? Actually, it's critical. We need it for mineral digestion, things like calcium, iron, zinc, magnesium, just to name a few. B12 movement through the stomach with a special protein called intrinsic factor, little hand holder. Protein digestion, and super important to prevent GI infections. Think Giardia and H. pylori. And then other most important things, so that this is why constipation is pretty common, is to stimulate the next digestive enzyme production in the small intestines. This is bioflow and pancreatic enzymes. And just so you know, the pH of the stomach should be between 1 and 2. Many folks have a pH of 3+, and worse, when you're on PPIs, it can be a pH of high of 6. That's almost neutral. That's insane to me. We're going to go through a list. Boring, I know, but I will chat about each drug class and give examples of the medications and what can happen, and then I'll move into supplements and do the same thing. So both prescription and over-the-counter medications, as we talked about with ibuprofen, can have an increased risk for things like heartburn and some other issues too, but that's what we're really going to stick with. These medications relax this lower esophageal sphincter. Remember, that's that little valve. They can irritate the throat. They can also decrease stomach acid production, leading to more acidity. Things like non-steroidal anti-inflammatory drugs like vitamin I, our dear friend ibuprofen, things like Motrin and Advil, aspirin, naproxen, that's also called Aleve, and Celebrex, or the generic celecoxib. These most of these can only be only celecoxib can be gotten prescription. The other ones are over the counter, and they definitely can cause GI bleeding and really good irritation of that throat or gastric tissue. Antibiotics, specifically tetracycline and doxycycline, can cause irritation of the throat. And tetracycline is one of the antibiotics that's used in quadruple therapy to treat H. pylori. Steroids, things like prednisone and other steroids that are used to treat asthma and COPD, even autoimmune, can increase the risk of acid reflux and heartburn. Some classes of blood pressure medications like amlodipine and beta blockers, atenolol and propranolol, can cause acid reflux, again, relaxing that valve between the throat and the stomach. Some common osteoporosis medications in the class of bisphosphonates, things like aldronginate and risdronginate, Fosamax and Asonel, excuse my pronunciations, these can cause irritation. They even, in fact, say on the bottle, sit upright and do not lay down after taking them. Some lesser used antidepressants, things like amitriptyline and nortriptyline, which can relax that sphincter. Both of these drugs are used to treat IBS, by the way, which is funny because sometimes IBS and reflux, they kind of have a relationship. Hormone therapies, oral progesterone found in hormone replacement can relax that esophageal muscle. Check out my HRT episode we just did. We talk a little bit about that. And now progestin only birth control is like oral progesterone, but this is a synthetic progesterone mimic that also relaxes those throat muscles. And then if you've ever had angina, chest pain, nitrites that they give you, those, I forget what the drug is, excuse me, but it can relax that lower esophageal sphincter. And supplements, oh my gosh, I just took a gal off a handful of supplements, well-intended and definitely help with pain. But man, if a person is dealing with reflux, they should not be given. We'll talk a little bit about those. Common offender, iron, often prescribed on an empty stomach, definitely can irritate the digestive tract. So be careful there. I often recommend taking it with food. And there are versions of iron that are better absorbed and less irritating. Potassium, this is just irritating to the stomach lining. High doses of vitamin C, especially the ascorbic acid variety, can irritate the throat. Fish oil, they can cause reflux in some people, but mostly I see fish oil burps, which tells me there's a fat absorption issue and a bile flow gallbladder problem. Oh my gosh, garlic supplements, great for the heart, right? And great for antimicrobial. However, relaxes that lower esophageal sphincter and can lead to heartburn. Turmeric, again, funny because it's used to treat a lot of digestive issues because it's pretty bitter, but in some folks, it can absolutely irritate the stomach and the throat and cause reflux. Now, enzymes, we have both. We have proteolytic enzymes and digestive enzymes. Proteolytic enzymes are used to treat pain. So that gal that I took some things off of, she was taking some proteolytic enzymes on an empty stomach, but she was getting really bad acid reflux. So those were a no-go for her. There are human trials that show it's really effective for treating pain, like arthritis. Then we have ginger supplements. While ginger is definitely helpful for nausea, it can definitely make heartburn worse for some people. So again, we have to be very specific in how we're dosing things. Peppermint oil caps, used to treat IBS, but has a relaxing effect on that lower esophageal sphincter and can cause reflux. And I say this to my patients all the time. If you take B vitamins on an empty stomach, you will never do it again because the nausea and upset gut feeling is so terrible. Only once that B vitamins get taken with food, period. Boswellia supplements, which is frankincense, these are used for pain, often safer than our ibuprofen types, but definitely can upset the tummies of some folks. And while it's well tolerated, we just got to be mindful of the person sitting in front of us. And essential oils. Love multi-level marketing companies, what they've done to promote essential oils. However, they do promote unsafe amounts of oral intake, which can trigger reflux and other GI issues, including causing stomach ulcers. So be mindful of oral intake of essential oils with a safe and reasonable dosing done under a supervision of a healthcare practitioner that is trained properly in how to dose essential oils. Okay, so all that to say, we went through 9 drugs and 12 supplements, which were discussed. This is not an exhaustive list, although it's pretty close. There's always more things that can be added. If you are experiencing heartburn after taking a new med or supplement, consult your healthcare practitioner. Do not stop your prescribed medication without medical advice. Adjustments to dosing, timing, or switching, as I talked about with maybe taking it with food, can be helpful to reduce symptoms while you keep taking an appropriate medication or supplement. And as usual, while I am a doctor, I am not your doctor. Plus, I'm a stranger on the internet, and you should definitely discuss any new treatments with your current healthcare practitioner before considering them. If you found this episode helpful, like and subscribe. That's how I know that you're getting value from my content. If it was controversial, drop a comment. Let's chat. That's how I learn. That's how we grow and become better humans and have a conversation. Thank you so much.